At Garrison Family Medical Group and AV Urgent Care, we have made some additions to what we are offering in response to the coronavirus crisis. First of all, we have added a telemedicine service. This is intended to allow any of our patients and anyone in our community who may need it to seek medical care while remaining in the comfort and safety of their own homes. Telemedicine allows us to provide the highest possible level of care to our patients, whether they can make it into our office or not. Through telemedicine, we can listen to your symptoms and concerns, evaluate you, hopefully obtain vital signs such as temperature, blood pressure, pulse, and oxygen level, and make an assessment of your medical situation, and with your assistance, formulate a treatment plan to help you get back to health as fast as possible. This plan may include medications, any tests that may be necessary, and we may even make a plan to get you any documentation you may need for your employer if we decide that you need to take some time off work. You do not have to be a regular patient of the practice to use our telemedicine services. In fact, we're happy to see new patients through the telemedicine platform as well. If you are a new patient, we ask that you complete the new patient registration forms on our website. The link to these documents will be in the description below. Virtual visits through our telemedicine platform use real-time audio and visual communications, and we are able to assess many issues very well, even without being in the same room. If you have a thermometer, blood pressure cuff, heart rate monitor, and/or a pulse oximeter, it would be really handy to have these available during your virtual visit in order to help your provider make the absolute best decisions about your care. If you don't have these items in your home, now would be a good time to get some. All of the items listed can be purchased on Amazon at a reasonable price, and most, if not all, can be purchased at your local pharmacy too. Occasionally, during a virtual visit, your provider may decide that you need a different level of care. They may determine that they need you to come to the office so that they can obtain a complete set of vital signs or listen to your lungs or heart. They may need to have you come into the urgent care briefly for a quick test such as a urinalysis, X-ray, or EKG. They also may send you to an imaging center or laboratory for further testing. Finally, they may determine based upon their virtual visit with you, including how you appear, your complaints, and other signs that you may not be aware of, but through video your provider may be able to notice, that you need to go to the emergency department immediately. If you've been exposed to someone with confirmed COVID-19 and are an essential worker, you may need to be placed on a 14-day isolation protocol. Following a telemedicine visit, our providers can provide you with any documentation your employer may request. We have not just added an option for virtual visits, though. We are now able to evaluate our patients and even conduct respiratory pathogen tests without our patient having to come into the office. While we have not set up a formal drive-through testing site, as a few other places have in the Antelope Valley, if your provider feels that you need a test for either COVID-19 or another respiratory pathogen, including strep throat, they can direct you to come into the office and stay in your car in the parking lot. Your provider will put on the appropriate protective equipment and come out to your car to obtain their sample. Occasionally, your provider may not feel that a virtual visit is adequate to give you the absolute best possible care. In this type of situation, they may ask you to drive up to the office and sit in your car. Your provider, again, will put on all the appropriate protective equipment and come to your car to check your oxygen level, heart rate, respiratory rate, or other vital signs. They may also listen to your heart, lungs, or abdomen, or even push on your belly and look in your throat or ears for further signs of illness. The expanded telemedicine visit and many simple point-of-care tests can occur while you remain in the safety of your car to help maintain the safety of social distancing. We do ask that you do not drive over to our office and request that your visit occur in your car. If you don't feel that you should come into the office, or if you're just not sure, please call and arrange for a telemedicine visit with one of our providers. The provider you see will determine during your visit if they need you to come to the office for an expanded virtual visit. We also have expanded hours on a case-by-case basis. Through the telemedicine platform, if you need to be seen later in the day, we may be able to see you after hours. This may depend on provider availability, your chief complaint, and the reason that you need to be seen outside of regular business hours. Unfortunately, we don't have enough providers to be available for telemedicine 24/7, 365, but if a provider is available and your need is more urgent and you cannot wait until the next scheduled availability, or if you are an essential worker and simply will not be available to be seen during the scheduled availability, we would be happy to accommodate you. If you have any suggestions of any other services that you would like to see us add, or suggestions of what we could do better, please feel free to let us know. Send an email to gfmgtelemedicine@gmail.com. Please note this is not a secure email server, so don't include any identifying or private information in this email. We will read and consider all suggestions, though, but please understand we may not be able to make every change suggested. That said, we do want to be as accommodating as possible and offer our patients and our community as a whole as many services as you all feel would be helpful. Whatever the situation, whatever your need, we at Garrison Family Medical Group and AV Urgent Care strive to help you in every way possible. We look forward to helping you feel better. While we may be separated, now is the time for us to come together as a community. We will continue to be here for you, in the office and through our virtual visits.